Did you know 500,000 people in the United States have feeding tubes, 20,000 of which are children? At the age of 2, my daughter was diagnosed with Crohn's disease IBD, and her first form of treatment was a feeding tube therapy with strict formula diet. At the age of 2, my son was diagnosed with failure to thrive, and he is now on a strict formula diet with feeding tube. Hence the fact making me a super tubey mom. There's a lot to learn about feeding tubes, and the equipment, supplies, and care instructions can be a bit overwhelming. Today I would like to walk you through the steps of how to properly care for a feeding tube using the Halyard Mickey G feeding tube, your guide to proper care. Cleaning the feeding tube is the first step in daily care. A feeding tube should be cleaned daily and is probably one of the most easiest tasks involved in caring for a feeding tube. The first thing you will want to do is have your soapy sterile water and Q-tips. You will clean around the button and make sure it's very clean. Once completed, you will dry off with either dry Q-tips or a tissue. Once dry, you will place your split sponge gauze around the button to protect the skin, and you will close it off with a piece of tape. What you need to know, a parent's introduction to tube feeding from the Feeding Tube Foundation, that the most common types of feeding tubes are the balloon buttons. Balloon buttons are most commonly used by doctors and are becoming more popular every day. A balloon button can easily be cared for by a caregiver or a parent with proper training. The balloon is what holds your button in place. You insert it with 5 mLs of water, and it blows up a small balloon-like bubble, in which holds the button in your stomach. To check this balloon, you will want to hold the button in place and remove the water that is in the balloon. Once removed, you will want to check to make sure that the correct amount of 5 mLs is in the balloon. If any water is missing, you will want to replenish that with clean, sterile water and insert it back into the balloon. Always be sure to use water, as air can leak out of the tube, causing the tube to become dislodged. This volume should be checked weekly to make sure that the correct amount of water is currently still in the balloon. Proper placement is also crucial. There are 2 ways to check placement. First, you can attach your extension to the G button. And using your 60 ml syringe, pull out some stomach fluid. If you are able to pull out the stomach fluid, this ensures that the button is in the correct place. You may also check the button placement by putting a stethoscope on the stomach and inserting a small amount of air into the tube. When that air hits the belly, you will hear a belly grumble, ensuring that the button is in the correct place. Changing the tube every 6 months is a very crucial part of caring for a feeding tube. You will first want to start by gathering your supplies and checking the replacement tube for any form of malfunctions, such as a hole in the little balloon. Once that is complete, you will start by removing the water from the balloon and removing the old tube. When the old tube is removed, you will want to clean the entire area around the open incision and dry it before placing the new tube. Before the new tube is placed, you will want to get your lubricating jelly and lubricate the tip to make this tube be easier and more comfortable while being inserted. Once inserted, you will fill the balloon up with the 5 mLs of water and check placement as I discussed earlier. When the placement is done, you will get your split sponge gauze, wrap it around the tube, and again, place the piece of tape on the opening to secure that the gauze does not come off. Changing the tube can be one of the most challenging parts of caring for a feeding tube, as it can be very traumatizing depending on what type of tube you have. As child life specialists Dawn Klosmere and Emily Jasanowski, mom of a medically fragile child and tube fed, once said, a child is less irritable, more comfortable, and more calm when they are slightly elevated or propped up. This is something that should definitely be considered whenever changing a tube, especially on a young child. As you can see, feeding tube care can be a bit overwhelming if not accustomed to it. Mickey and nasogastric tubes have been a part of my life for over 3 years now. It took some time, but we are now accustomed to it. And now that we have experienced this life, it has now become a daily habit. Feeding tubes in children are a lot more common than what people think, and you never know when you might be able to help. The most important things to remember are daily cleaning, balloon and placement checks, and changing the tube every 6 months. I would like to close today with a passage from What We Want You to Know, a family and friend guide of tube feeding by the Tube Feeding Awareness Foundation. We need support from loved ones. It can be hard for people to understand why our children need tube feeds because many of them don't look sick. Tube feeding helps provide our children with the nourishment and feedings they need, and it is important to remember that it may take a lot of work to keep our children looking healthy and nourished. It can be a strain on our families, especially when we have other children or we are working. You can learn to help, not as scary as you might think. Just follow the parents' lead. Let them know you are there for them, and most importantly, be willing to learn so you can help. Thank you.